this is a longitudinal section. Okay, so that means that if I take this, say I take my radius right here on the thumb side, I would take a section of it this way, the long way. Okay, look at the long way, along a frontal plane. Okay, not a cross section. A cross section would be like this, right? Cross section would be on the transverse plane. Okay, so this is, you get the long way. So you should get compact bone on each side. There's not any spongy bone lining the inside on this particular bone. Sometimes there is. And then you should get what in the middle?
Marrow.
Marrow in the middle. Yeah, you don't have to identify yellow versus red. It's, in most of these slides, it's kind of somewhere in between. Okay, so here's the compact bone on one side. It doesn't look like osteons. You can't see that because of the way it's been prepared. So this is the one that we wanted to look for the cells and the organic stuff like the marrow. Okay, here's the compact bone on the other side. Sometimes there's some spaces that's not really going to be there in life. When tissues are cut, sometimes they spread, sometimes they fall apart. Okay, our slides are as good slides as we can get. They're not as picture perfect as what you would see like in your textbook. So that's why you don't see that space in your textbook. Okay, so let's look at this side. How many of you guys found the periosteum? Raise your hand. Just a few groups. Okay. That's kind of, I don't even see it on this one. Okay, so where should we look to see osteocytes? So are we going to look here? Are we going to look here? Or are we going to look here?
In the pink zone.
The last option. In here. Not in here. This is marrow. Marrow is developing blood cells. And if it's a mix or if it's yellow marrow, then it'll have lots of adipocytes too. Okay, so this is marrow. We're going to look in here in the hard mineralized matrix for those osteocytes. So we need to move up magnification to do that. Still not super clear. Okay, so the bigger spaces, those are you're getting portions of central canals or portions of perforating canals. That's what you're seeing there here when you see these bigger spaces. It's the smaller spaces here that have the lacuna and the osteocyte.